Hello guys, welcome back, and today we are going to discuss about other nursing diagnosis and care plans. So nursing diagnosis is about risk for thrombosis. Thrombosis means what? Blood clot, right? So we'll see what is Nanda nursing diagnosis. So nursing diagnosis for risk for thrombosis has been defined by Nanda International or North American Nursing Diagnosis Association International as a state in which a person is at increased risk for developing a clot in a vein or artery. Developing a clot in a vein or artery. That is called thrombosis. And the risk factors include inability to move about freely and being overweight or obese. And now we will see a bit detailing what is thrombosis. So in thrombosis, what will happen in your vein or artery, there will be a disruption or difficulty or obstruction in the normal blood flow will develop. That is called thrombosis. And anyone who is bedridden for prolonged periods or overweight or obese or has a family history of thrombosis or smokes are all at high risk for developing thrombosis. So who are bedridden for a long period because of any reasons like surgery or any accidents or anything, and overweight, obese, or family history of thrombosis or smoking. These all things are considering as the factors or etiological factors or risk factors behind thrombosis. And also, okay, women using oral contraceptives and certain intrauterine devices or hormone replacement therapy are also more likely to be affected with thrombosis. Guys, keep this point in your mind. Then the conditions most commonly linked to venous thromboembolism, okay, it can lead to thromboembolism, okay, MI or myocardial infarction, peripheral artery diseases, and even stroke. So if you use your common sense, you will understand how these diseases will or problems will arise in the person, followed by thrombosis. Because what will happen? Your artery or vein will get disrupted. Okay, the disrupting the normal blood flow will take place, and that can lead to these conditions. The preventive methods include maintaining correct foot and leg posture when sitting, and practicing light activities, and undertaking regular exercise and eating a healthy balanced life. So leg and foot posture. So when we sitting, you have to maintain a proper foot and leg posture. Okay, then practice light activities. You have to do some activities, one or another type of activities depend upon the condition. And regular exercise doesn't mean that you have to go to gym and do the exercise. You have to do some kind of exercises and eating a healthy balanced diet. That is the foremost thing. Okay, eating a healthy balanced diet. Now we will see the nursing diagnosis. So there are some nursing diagnoses I have added here. You can take the nursing diagnosis depend upon the condition of your patient. So to understand the condition of patient, you need to talk to your patient or you need to read the case sheet. So first nursing diagnosis is risk for thrombosis related to immobility due to post surgical recovery as evidenced by restricted mobility, prolonged bed rest, and the need for external compression devices. Risk for thrombosis related to immobility due to post-surgical recovery as evidenced by restricted mobility. Okay, second one, risk for thrombosis related to hypercoagulability from oral contraceptive use and smoking as evidenced by history of smoking, use of estrogen-based contraceptives, and sedentary lifestyle. Then third one, risk for thrombosis related to vascular injury from recent surgery or trauma as evidenced by surgical wound, immobility, and use of compression, stocking or compression devices. Okay, so nursing diagnosis are here. You can use depend upon the condition of your patient. Now we will see the nursing care plan. So while writing your nursing care plan, you have to follow this format. Okay, in previous videos, in all the videos, I'm telling the same thing. Assessment, diagnosis, planning, rational, implementation, and one more column. What is that? Evaluation. Okay. So assessment, diagnosis, planning, rational, implementation, and evaluation. All these columns you have to add in your nursing care plan. So under assessment, what you have to write? You have to write both subjective data and objective data. What is subjective data? What is your patient's complaints? What your patient says about their condition? Okay, that is subjective data. Next one is objective data. What is objective data? How the patient looks like. What is your observation about your patient? That is objective data. So here I've just written like this. The patient complains that he or she has swelling and calf pain. And what is objective data? The patient looks very dull and tired. Then diagnosis you can write depend upon the condition of the patient. I didn't write the diagnosis here. I've just written the goal here. So in diagnosis column, two things we will write: diagnosis and goal. Okay. So this is the goal of this nursing care plan. The patient will remain free of signs and symptoms of thrombosis such as swelling, redness, warmth and extremities, warmth in the extremities, or the patient will demonstrate understanding of preventive measures for thrombosis by actively participating in ambulation compression therapy and taking medication. So I didn't write the diagnosis here. You can write the diagnosis depend upon the condition of your patient, and this is the goal. Okay, you can only see goal. So in diagnosis column, you have to write diagnosis as well as the goal. The patient will remain free of signs and symptoms of thrombosis. Here, what you can see future tense, right? Patient will remain. That is the goal. The patient will demonstrate understanding of preventive measures. That is the goal. Next, we will see the planning, then rationale and implementation. While writing the planning, always write your planning in present tense. Rationale, you can start with to. Implementation, always in past tense. Do history collection and physical examination. Forward, to understand the general condition of the patient. Done history collection and physical examination. Second, planning. Review medical, surgical and family history of thrombosis or and observe for signs of DVT. What is DVT? Deep vein thrombosis. Review medical, surgical and family history of thrombosis, or you can write observe for signs of DVT. For what? To identify the root cause of the problem. Implementation: reviewed and observed for swelling, redness, warmth in the extremities. Reviewed and observed for what you have observed, that you can write in implementation. So I have observed like swelling, redness, warmth in the extremities. Then next, planning. Evaluate skin integrity and sensation in the limbs and symptoms of stroke. Evaluate skin integrity and sensations in the limb and also symptoms of stroke. What is the rationale? To prevent the further complication. And in implementation, evaluated and assess the symptoms. Then next, planning. Assess the patient's extremities for signs of thrombosis and monitor vital signs. Monitoring vital signs is very, very important in this condition. Assess the patient's extremities for signs of thrombosis. Okay, and monitor vital signs. For what? To understand the signs of thrombosis and other complications. In implementation, you can write assess the signs. What you have assessed that you can write there. What you have assessed: assess the signs like cough, pain, swelling, warmth and monitored especially the respiratory rate and oxygen saturation. What you have observed, okay, that you can write in implementation again. Then encourage early ambulation post surgery or after periods of immobility. For what? To promote mobility. Encourage early ambulation, encourage movement. Okay, then for and what is implementation? Encourage the process of early ambulation, not amputation, guys. Ambulation, movement. Okay, then next, planning. Assess with the range of motion, that is ROM, range of motion exercise for bedbound patient. The patient is on bed, means assess with the range of motion activities for what? To improve the blood circulation. Assisted and started perform range of motion exercise. Then use compression devices for what? To reduce the symptom. When you use a compression device, now the blood flow will increase. And in implementation, you can write what type of compression devices you have used. If anything you have used only, you can write this planning, guys. Used, apply anti-embolism stockings, house, okay, or intermittent pneumatic compression IPC device. Whatever you have used, that you can write. If you are not using sometimes some ice packs, okay, some or any other compression things will use, depend upon the condition what you're using, that you have to write there. If you're not using, no need of mentioning that planning. Then administer medication as prescribed. That's common thing, and you have to add that planning. Basically in this condition, medication is compulsory thing. Okay, so with medication only you can remove the clot. Sometime even after surgery, if you're not giving proper medication, that can lead to infections also. So administer medications as prescribed for what? To reduce the symptom. Then You can write administered medication and you can write what type of medication. So heparin, warfarin, aspirin and all using to prevent the blood clot. So you can write that. Then next planning, teach patients about their risk factors for thrombosis. That's very, very important. So as a nurse or as a healthcare professional, it's your responsibility to inform what is the risk factor behind this condition, what can leads to this condition, okay, or what if you do like this is the result. So you have to educate them. Teach the patients about their risk factors for thrombosis. For what? To improve their awareness. Taught and provided instructions on warning signs of DVT or deep vein thrombosis. Then next, encourage adequate fluid intake. Very, very important. For what? To reduce blood viscosity, which decreases the risk of clot formation. Then in implementation, you can write encourage the intake of fluid, and you can prepare a fluid intake chart, and information also you can add in the implementation. Then next planning, advise the patient to avoid prolonged sitting. Okay, if the patient can sit, a patient is on bed always, no need of writing that planning. Okay, the patient is sitting and all the time means you can write that planning. What is the planning? Advise the patient to avoid prolonged sitting. For what? To avoid the impairment of blood circulation and also to promote circulation. Then implementation, advised and elevated the leg slightly. Advised and elevated the leg slightly. Always if you give pressure to the foot, no, automatically what blood flow will get impaired, and what will happen? Thrombosis will develop, swelling will develop. So advise and elevated the leg slightly. And evaluation, you can write the patient remain free of signs and symptoms of thrombosis such as swelling, redness and warmth in the extremities. Also, you can write the patient demonstrated an understanding of preventive measures for thrombosis by actively participating in ambulation, compression therapy and taking medication. So this is the planning, rational implementation and evaluation for risk for thrombosis. So you have to understand what is thrombosis first. Without understanding, you cannot develop this plan. Hope you understand, guys. Thank you. And next time with another nursing diagnosis and care plan. Bye bye, guys.